What kind of psychological preparation can you do before a hysterectomy? Hi, I'm Linda and I'm a reproductive health psychologist and fertility counselor. I help people with the ups and downs of fertility treatment, but that also includes individuals who will be seeking hysterectomies for medical reasons. I think one of the things that you can expect psychologically to happen if you move forward with a hysterectomy is that you're going to be experiencing a lot of fear leading up to it. Oftentimes with my patients, it's a fear of regret. Did I make the wrong decision? One of the ways I like to address that is having some of my patients fill out a quality of life measurement. It's really hard to remember pain. Our bodies are built that way. Our bodies are built to forget pain often. And one thing I think would be really nice is for you to have really great documentation of why you had to make this decision. And a quality of life measure would really capture that for you, and you could reflect on that in the future. Another thing outside of fear that I think you can prepare for psychologically is grief and loss. Grief and loss that you've had to go through this process, grief and loss being able to carry a child. It all depends, of course, on what is removed. Not all uterus and ovaries are always removed. But if your uterus is moved, you will not be able to carry a child. And that may be the end of your family building journey unless you can move forward to use a gestational carrier surrogate, whether that's someone you know or someone you don't. If your ovaries are removed and you do not have the resources to extract the eggs from your ovaries, there also could be genetic loss that's wrapped in this hysterectomy. Because for many people, if they do want a family build, many people do want to contribute genetically. So those are some things that you can be thinking about are likely to come up not only prior to your hysterectomy, but even after. Of course, last but not least, anger. It's not fair. It's not fair that you were up against such a difficult medical condition. It takes usually so much work to advocate for yourself to even get a hysterectomy. But even if you're able to get it, there's still a lot of anger that often people are working to try to process through because of what a difficult situation they were put in, where they didn't want to have a hysterectomy but chose to for medical reasons because they were under so much pain, discomfort, and it was impacting their ability to live. If you think this is helpful, follow along for more tips. Of course, don't be shy about making a comment if there's something I can expand on as well.